in proper medication. So we get to 4 stations every week with their satellite stations, which is very, very helpful, and with a very, very minimal price. That is one good thing about it. They pay very less money for essential drugs, and also avoid trekking, pain or fears, and displacement. So it's a very, very vital thing. And CADO, I think they are really replicating and seeing what CADO really stands for, Catholic Development Office. So you can develop somebody behind health. So I think it is really, really fine. And 3-4 years ago, we think it's also necessary to include in another intervention, that is HIV and AIDS. It is better to prevent than cure, as the saying goes. So we incorporated HIV program into this 4 stations. We make sure that every pregnant women attending this clinic is screened of HIV positive. If the results happens to be positive, unfortunately, this woman is taken care of, referred to treatment centers. That is, our partner here is Hands-on Care at Brikama. Excuse me, we do make a follow-up and have to establish whether the person is really confirmed positive, and then management continues. Because here our main target is to prevent the child in the womb from infection, and which is a major goal really, and that's also one way of curbing prevalence rate. So that is also going smoothly. And apart from that, we also organize VCT, that is in communities. That is voluntary counseling and testing. We meet the alcalos, head of the village VDC, that is village development committees. They'll organize meetings and we sit at the Bantaba, wherever they think is feasible for them. We talk to them about HIV, what it implicates, the damage it does to the society, particularly the young ones, which is our major targets, of course, from 15 to 49 years. It's a very, very crucial group because they are the most sexually active people. So it is an area we are very much concerned.
How do you see this work of helping women and anyone who comes in here?
I see it fine. Since I started even working, since in 1989, I have been working with the Catholic Mobile Clinic, so I appreciate the work. I never even want to go to any other clinic, so I appreciate the work in the mobile clinic to give service to the poor and to serve the poor and the needed all. Yes. And they appreciate the work, of course. They appreciate it because they are happy when they come to the clinic.
From these sessions, and send them also to Hands-on Care for confirmation of their status and management. Yeah, so I think CADO is doing a very, very good job. We only hope and pray that we expand as we wish. With the present management, I think we have we call them ambitious, because I think they want to spread more, and we hope and pray that this thing is really actualized and we got it as we really dreamt of. It's a fertile dream.
In fact, I wanted to ask you, what will your dream, your future, what do you think this can be tomorrow?
Yeah, we of course, with what we are doing, we are fine with, but whenever you are doing something, you always want to improve. So if facilities are available, materials, resources, we would want to maybe step out to reach more communities. Yes, of course, and see whether we can cover more areas as we propose, though we have only clients on 4 days in a week. So, but with other programs, we want to cover more area, if possible, if in the whole the entire West Coast region.
And the clinic is open to all, irrespective of where you come from?
Yeah, the clinic, we even get people even from Brikama, which is a major town. Women come here to register for antenatal visits. So we take that there's no discrimination where you come from. Even if you are living next to a major health center and you decided to come to a mobile clinic, we welcome you. So we have no problem with that, and we take everybody on board. Yes. With cases that we can't manage in our level here, they are referred to major health centers or facilities.
So when do you come here, and what are the other villages that you go to?
We normally come to Kitty itself here, this station, every Tuesday for 1 month. And we go at station for 4 clinics. We go to Mandwar, Kuloro, Samakunda, and Kitty. Every week we go there for a month.
And you have been doing this since 1988?
I started working with the sister, with the first sister I started working with, Sister Catherine Ford in '89. That time we are running the clinic at Daslami, Kartong, Berending, and Kitty itself.
Yes, it is very, very good, and it has paid a dividend really, because awareness is one tool to fight certain conditions. And this is, you need to talk to people, tell them what this meant and how to avoid it, how to fight it. So in terms of pregnant women coming to the clinic is a necessity. And I think they are responding in larger numbers. Because in just recent time ago, you can see pregnant women, they get pregnant, they doesn't come to the clinic until delivery. So they are very, very high risk. Some may even die of malaria, abortion, anemia, or to name a few. But now that things have changed dramatically because they are monitored. We take your blood sample, send it to the counter, know your HB and know your HIV status. So it's a step in the right direction.
The building here, there was no building here. You can see the old building. That's what they were using before. But some years back, they were able to get some more money to be able to build the proper clinic where patients would come and people from the community. The idea is to help bring health care to the doorsteps of the people, because at the time the road network here was not very good. It was a struggle for people, especially the women and children, to reach out to Brikama to be able to get health services. We are grateful to the donors, and we are also grateful to our Lord Bishop and Father Sean for the efforts they do every time to get us funds to be able to run the clinic, as well as the cooperation that we have with the district health authorities, because they work in tandem with the district health authorities in Brikama to provide the services to the people.
Brothers and sisters, we now look at our readings. Our first reading is taken from the book of Ecclesiasticus, chapter 15, verses 15 to 20. Auntie Elendur will do the first reading for us.
Jangatu tere sirak borom sagosa. So buge munga topa yeple yi. Deka di chataku. Tiyawla ajo. Borom bi tek na ci sa kanam ndox ak safara. Talala salho ci bala gënal dee ak dunda lañu won nit ñi ñu tanal seen boppa li leen gënal ndege sagos borom bi reyna borom katan la te lépa lay gis sépp nañu ko ragal xamna lépa li nit ñi di def yebalut kenn mu di julitadi mayu kenn muy bakar batum yalla la sante nañu yalla pour suñu som dinañu woy te fatele kul yalla sa borom mi la sakal yoon ndege sa mur calahira bare nañu muur ñi di dox bu jub di topp yoonu borom bi bare nañu muur ñi jàppal wëllëreem di ko ut bañ a tàyyi ak cawarte fit te fàttalekul yàlla sa borom mi la sàkkal yoon ndege sa muur ca laaxira yow dogal nga say yéple ñax ñu leen toppa dégg borom bi déggaral suma fit dama toppa say mbugeel te fàttalekul yàlla sa borom mi la sàkkal yoon ndege sa muur ca laaxira woneel sa baaxaay ci sa surga te man dina dundi yi toppa say yéple ibil suma bit bot ma gis say yéple yu doy waar yi te
fatele kul yalla sa borom mi la sakal yoon dégg sa muur